I'm Dale Rader. I'm a board-certified, fellowship-trained orthopedic surgeon at EmergeOrtho. And today we're going to talk about various abnormalities in orthopedics. So an arthritic shoulder is going to be painful, of course. Patients are going to have stiffness, decreased motion, and weakness in their shoulder. Just like with anything else, as we get older, you're going to typically see arthritis, whether it be in the shoulder or any other joint, say above the age of 60. It's when we would see that more commonly. But you can see it earlier, especially if the arthritis is secondary to trauma. So if you've had an old sports injury or a car accident, those patients can develop what we call post-traumatic arthritis, and they can develop that at much younger ages. So arthritis on an X-ray kind of has four hallmark features that we talk about. Joint space narrowing, which means that the joint space is closed and looks more narrow. Osteophytes or bone spurs, which you can easily see on X-ray. Subchondral cysts, which are little hollow areas in the bone, which you can easily see on X-ray, or subchondral sclerosis, which means whitening of the bone surfaces. And that occurs because the cartilage in your joint has been worn away, and then the bone is having more pressure placed on it, and so your bone looks whiter because it's getting harder because of the increased pressure being placed on it. Treatments for shoulder arthritis will start out conservative. You can do physical therapy, anti-inflammatory medications like Celebrex and meloxicam, Advil, Aleve, Tylenol can be used as well. We oftentimes will do steroid injections, which gives patients relief for months at a time. If those things are not effective, typically the next step would be surgery for total shoulder replacement. That can either be what's called an anatomic shoulder replacement or reverse total shoulder replacement. And the difference is between those two surgeries, if your rotator cuff is torn and it's not repairable, typically that's when we would convert to what's called reverse total shoulder replacement. Patients can tolerate shoulder arthritis a lot longer than they can, say, arthritis in the hip or knee, because we don't walk on our arm, so they typically get away with that pain and can manage their symptoms much longer than they can, say, in the hip or knee. Again, just like anything else, sooner is better than later. You know, when your pain is out of control, when it is not controlled with, say, Tylenol, Advil, Aleve anymore, when you're having difficulty sleeping and it's starting to affect your activities of daily living, is when we would tell you to come in.